Jaundice is the condition in which the pigment known as bilirubin in your blood rises and is getting deposited in your skin and your eyes and inside your mouth and makes you look a little bit yellow in color. Now, for that you have to understand the pathway of how you have a bilirubin metabolism. It is formed from the breakdown of the blood cell. This bilirubin is transported in the blood, taken to the liver, and a small chemical change is made within the liver, and this bilirubin is secreted out into the fluid known as bile, into the intestine, which helps in digestion. Now, anywhere along this pathway, if there is any abnormality, the bilirubin tends to pile up, and this causes a yellow color in your skin as well as your eyes. For example, if you've got any disease that will result in your blood cells breaking faster, for example, if you've got malaria, your blood cells will break faster and produce more bilirubin at a rate that overwhelms the liver's capacity to secrete it into the blood. So this will cause a jaundice. Further down the pathway, if there is something wrong with your liver, for example, if there are any infections or chronic liver damage, maybe due to alcohol, you can have again bilirubin rise in your blood. A little more downstream, if you have got something that obstructs the flow of bilirubin in the bile into the intestines, for example, let's say there is a gallbladder stone that is blocking the tube that transports the bile, or say there is any cancerous growth that is blocking the flow of bile, this again will cause a rise in the bilirubin. Symptoms of jaundice are very varied. You can be totally asymptomatic. In fact, there are a small subset of patients who normally have a little high level of bilirubin in their blood. I mean, it's because by birth their liver is not very good at managing the bilirubin. In such patients, there is absolutely no symptom at all. There is just a little yellowish discoloration, and this is known as Gilbert syndrome, and it does not require treatment at all. Coming to any liver disease that may be causing symptoms of jaundice, it would depend on whether the liver disease is acute, sudden, or whether it is long-standing. Now, if you've got an acute liver disease that is resulting in jaundice, you are likely to be having severe fever, vomiting, abdominal pain, nausea even on the smell of foods, and you're likely to be very sick and you might require hospitalization too. Whereas if you're having chronic liver diseases, this may be due to any chronic viral infections of the liver. It can be due to alcohol-induced liver damage. Many causes are there. And these chronic liver disease symptoms, usually the patient will be having tiredness and low levels of hemoglobin in the blood. And the patient may be having jaundice, may be having swelling in the stomach and in the hands and the feet and the face due to collection of water, may be having itching all over the body. So that is one scenario of jaundice. Now, if you're having any obstruction down the lane where the bile is getting secreted into the intestine, that can present acutely or long-standing. Now, acute presentations like due to stone problems can cause severe abdominal pain and vomiting and jaundice, whereas chronic problems like slowly growing cancerous growths that are infiltrating into the duct that transports the bile, that can result in patient having loss of appetite, loss of weight, deeply progressing jaundice, itching all over the body, and the passage of greasy and clay-colored stools. The first thing you should do is to visit a doctor. Remember, there are some people who run to traditional healers or take herbal remedies to treat jaundice. But this is not a correct approach, simply because the cause of jaundice is not the same in everybody, and every jaundice does not require treatment. The first thing you will have to do, as I told you, you will have to visit a doctor who will first do tests to find out, to confirm that what you are having is indeed jaundice. The second thing they will do tests to determine what is the cause of jaundice. This includes blood tests as well as scans of the stomach, including the liver, gallbladder, intestines, etc. And the treatment would depend on the cause of the jaundice. For example, if you're having infections that cause jaundice, you need to treat the infection. If you're having any diseases where the blood cells are bursting fast, like malaria or G6PD deficiency. It's very common here in the Arab world. It's called naqs khamira. In such conditions, just adhering to a correct diet that prevents your blood cells from breaking will do the trick.